Good morning, everyone, and welcome to Invitation to a Conversation. I know there's a lot going on for this weekend because of the Juneteenth holiday coming up on Monday. So, today, in celebration of Juneteenth, we are going to have a conversation on sickle cell. So, my guest today is Dr. Delores Mitchell and Miss Mariah Carter. Good morning, ladies. How you doing?
Good morning. Doing well.
Morning. We're well.
All right. Um, my invitation to a conversation community. Dr. Mitchell is at a Juneteenth celebration. So if you hear some noise or whatever, I hope it doesn't interfere. But we're going to go on with our conversation. All right. So, ladies, um, can y'all tell me, either one, um, can you give me the definition of sickle cell? Define sickle cell.
Okay.
Okay. Sickle cell actually is a blood disorder, and I'm not sure if you can hear me well, but it is a blood disorder, and it's classified as a rare blood disorder because you have less than 200,000 people in the sickle cell arena. So what it is, sickle cell, hemoglobin is the main thing when you're talking about sickle cell because hemoglobin, oxygen, which is oxygen in the blood is not getting enough oxygen. And even with sickle cell, the cells die quick. Normal cells last 120 days. Sickle cells are always dying. So that is probably in a nutshell what it is. It's a rare blood disorder and it is genetic.
Can those blood cells reproduce itself?
Will you repeat that?
Can the sickle cells, once they die off, can they reproduce into good cells?
Yeah, it's your cells dying, not necessarily the sickle cells, but the cells in general. Yeah, cells regenerate, but you still have the sickle cell condition. Normal cells last, like I said, for at least 120 days before they die. So the cells is a dying process, but sickle cells die. The person with sickle cell, their cells die quicker and faster.
Mhm. What has anybody found in research or anything? What's the cause of sickle cell, Miss Carter?
Yeah. So, as she mentioned, sickle cell is an inherited blood disorder, and so it's passed down from, mother or father, and so that's why it's so important for our African American and Black communities to understand what their status is, so that they don't pass that disease down to their offspring.
So let me ask either one of you this question. What is the trait versus sickle cell, full blown sickle cell? What is the trait versus sickle cell?
Yes. So the sickle cell trait is not something where you have symptoms from. We run across people all the time at the American Red Cross that are able to donate despite the fact that they have the sickle cell trait. The sickle cell disease, however, is the disease. It does carry the symptoms of sickle cell. And so, unfortunately, patients that have sickle cell disease cannot donate. They're the ones that are recipients of frequent blood transfusions.
Okay. Um what so can somebody live with the trait and their partner have sickle cell? And if they have children, what is the outcome of that?
Right. So someone with sickle cell trait can live with the trait. If their significant other has the disease, it does increase the likelihood of their children also having the disease as well.
Okay.
So the
Um,
percentage just increases.
So can the sickle cell trait be diagnosed when you take your child to the doctors in the beginning stage, or is it something that is suppressed in your body and comes out later?
Yeah. So yeah, it's definitely something that I think we've kind of gotten away from with testing children at a young age. But it's something that, especially us as African Americans, should know our status regarding the sickle cell disease. And so, with the American Red Cross, one of the things that we do is we do sickle cell trait testing to see if you do carry the trait. And so, again, if you know that you carry the trait, you want to be cautious, especially if you haven't had children yet. So that's why we really try to educate our younger generations, because sickle cell is not something that's it's not necessarily curable. You know, we have things that can help it. But
Mhm.
I would say, as far as education, that's the biggest component, right? We can kind of prevent people from getting the disease if we educate those at a young age. And so that's why my job as a sickle cell account manager, I do a lot of time just educating people, and particularly our younger generations, on the value of knowing what their status is, because they haven't had children yet. And so it's important for them to know if they have the trait, because, again, the likelihood of them potentially passing the disease to their children becomes higher.
So let's take
And
a baby at
Miss
birth.
Bailey, may I add something?
Yes, yes,
Miss Bailey, can I add something to that? Can you hear me
yes,
okay? I had to move into my car.
yes.
Okay. Um, all babies, when they're born at birth, they are screened for sickle cell disease and a lot of other issues that doctors don't tell you about. So let's say I'm a mom and I have a child. At birth, that child is screened. If the child has a sickle cell trait, then the doctor should alert the parent saying, okay, your child has sickle cell trait. And preferably, like Mariah said, education is key. Because if the doctor says, okay, your child has sickle cell trait, and you don't have an understanding and you don't ask questions and they don't explain it to you, then it falls through the cracks. So then, parent, that's why Tapestry, we're out here creating awareness to sickle cell disease, sickle cell trait, so that people will know, especially when it comes to family planning with the trait. Your mate, you need to know their sickle cell status. Also, along with newborn screening, the Sickle Cell Foundation, which is a group that I partner with, they get all of the information from the newborn screenings. They also send letters to these parents alerting them, okay, your child has the sickle cell trait. Now, meanwhile, if they have the sickle cell disease, that I think the doctors start talking about that. If they're, that's what they should do. But the trait is the thing that's going to keep the disease going from generation to generation, and that's what we are out here trying to do, to educate. Know your sickle cell status. I wear a T-shirt that says, "Do you know your sickle cell status?" And people look at you, what are you talking about? So it's a lot of work to be done. But as stated prior, all babies, this was not always the case, but all newborns are screened for sickle cell. And as Mariah stated, if you donate blood, because sickle cell warriors, when they're in a crisis, they do blood therapy, and that's the blood transfusion. They will check you to see if you have the sickle cell trait, and that's an awesome thing that the Red Cross does.
So, at the time of birth, is the exam one of the when they you know how they stick the baby in the foot and take various samples of blood? Is sickle cell one of the things they are testing for when they do that? Is that from the foot exam, or that's a whole different type of exam they do on newborns?
They're testing for sickle cell and probably a lot of other diseases as well.
Can sickle cell be treated can sickle cell be treated at an infant stage? Can it be treated, and can it be dormant like cancer?
No, if you have sickle cell disease, or sickle cell anemia, whichever you prefer, you have sickle cell. And at birth, they penicillin. They will start giving the newborn penicillin because some people, most people who have sickle cell, they're prone to infections. So they start the newborn with the sickle cell with penicillin. I don't know at what how many days or anything like that. I don't know all the uh, ins and outs about that, but I do know that they treat uh, the babies, the young ones, with penicillin to prevent infection. And I'm not sure about whatever else they will do for them at such an early age. But the parents do know, and I know some of the children, once they get older, they do, I think, like maybe at age 2 or maybe even earlier, they take a drug called hydroxyurea, which is to help, which helps build the fetal hemoglobin in the sickle cell person, which is a buffer against sickle cell crises.
Now, what is the lifespan of someone who has sickle cell? Can they live longer with sickle cell opposed to past times? Either one of you all.
Yeah, I would say that I mean, this is unfortunately, a life-threatening disease. And I think the more that we put emphasis on sickle cell disease, I will say sickle cell disease is kind of one of those silent killers among our communities because it hasn't gotten a lot of attention. We talk more about, the diabetes, the high blood pressure, those other conditions that are disproportionately impacting our communities. And so I think, even with the Red Cross, it became something through research that we saw really needed attention. And so that's why, the Red Cross created initiatives like sickle cell disease to be sickle cell managers, again, to spread awareness and education. So I think the more that we learn about it, the better off we're able to help people. Because again, the
Okay.
more that we try to educate people on the importance and the value of donating blood, it helps people that are battling sickle cell disease because, again, they need lifelong transfusions. And so, again, it just helps. It makes everything better.
Okay. Is the treat is the treatment of sickle cell anemia the same for everybody? Take us through a basic treatment for someone who has sickle cell and you initially find out they have it. What is this process now? Where do you start and how do you treat that person?
First of all, regarding lifespan, I think long time ago they said 40 years would be the lifespan. Sickle cell is such it's a tricky disease and it's not the same for everyone. We have people who live into their 60s and 70s and beyond with sickle cell disease. And basically, it's the kind of sickle cell that you have. Once someone's diagnosed with sickle cell, they said, okay, you have this kind of sickle cell. And then they begin treating them with the various drugs. Until recently, we only had like a few drugs to treat a sickle cell disease, and we could have an entire conversation about the disparities with African Americans in healthcare, and sickle cell disease is one of those topics that we could talk about as far as the health care field. But what happens is I think it was in 2017, 2019, there were 3 other drugs that the FDA approved. And what I want to say too is with a lot of other diseases or ailments, um, have hundreds of drugs. And when you think about sickle cell, which has been around over 100 years, we only have like maybe 4, I think less than 10 drugs. I know 4 drugs for sure. So those drugs are used um, to treat the patients, and then of course they have a blood therapy, which is a blood transfusion, and then the painkillers, the opioids, because when they go into a pain crisis.
So you mentioned the word, the type of sickle cell. Is there more than one type of sickle cell?
Yes,
Can you
the
please
most uh, well, I'm not sure if I'm going to remember all of them, but the most, the one that most people will get was sickle cell SS, which is hemoglobin S, and I don't know all the pathology, and I'm not about to get into all of that, but that's the one that comes with the severe pain crises. And then there's also sickle cell SC, and there's also sickle cell thalassemia. Now, I think there are a few others, but right now they're not coming to my mind.
now that I
But the
never knew.
SS
I did not.
is common.
Mhm. That I did not know. I just thought sickle cell was just sickle cell. I did not know there was various type. So what is the most common? You said the most common is the S, the sickle.
SS, SS, sickle
Okay.
cell SS.
Okay. And you mentioned some disparity. What is one of the type of the most disparaging things in the healthcare system treating sickle cell? Because they say that most diseases, they say it's more dominant among the African American community. So what is one of the main disparaging things that happens in the medical field with sickle cell and African Americans?
Yeah, I would say one of the things that I hear a lot in the field is just the stereotypes that are associated with the disease. I think a lot of times, I mean, for instance, my mom suffers with lupus, and a lot of times people, you don't appear as if you're sick, right? And so it's almost like this association that you're drug seeking. And there's just a lot of different, unfortunately, just racial discrimination that people experience when they go through these crises. But that's one of the biggest ones that I constantly hear when I'm talking to patients that are battling sickle cell disease.
Okay. Very good conversation. Um, does when people have sickle cell, does their diet have to change as far as their food consumption?
They should be aware of some of the things that they eat. I mean, just eating healthy. The berries, they need to do those, the greens. Even when you cook some greens, that juice that's on the greens, you want to consume all of that. So berries, the green food group, all of those things that anyone would eat to be healthy. That's what a person who has sickle cell disease should do. And I didn't hear all of what Mariah said as far as disparities, but a lot of the doctors and nurses, emergency room attendants, they don't understand sickle cell disease. So, and because we keep saying it's predominantly an African American disease because we are of African descent. Sickle cell disease is in every culture, basically. We have Caucasians who have sickle cell or sickle cell trait. You have Indians, so the ones in India and the Mediterranean, Latinos. So we always say it's a global problem, not just with African Americans, and of course it's in Africa because that's where it came from. But it's a global problem. But the biggest thing with the disparities going to the emergency room, having to sit there and wait, there's no sickle cell protocol. If I go to the emergency room and I'm having a heart attack, touch my chest, they're going to wheel me in real quick. But if I have sickle cell, I'm going to have to sit there for a couple of hours before I'm treated. And that's because lack of education. I don't know what they do in the nursing schools or in doctors' trainings, but it's definitely a big gap there as far as treatment training
Now
and
you now you
consideration for those with sickle cell disease.
so you just brought up another interesting fact. So when a person goes to medical school, I understand that some medical, what I want to say, like some medical things that you study, you specialize in it, or you learn the basic generalization of medical treating somebody. So sickle cell is not part of that course when someone goes to medical school.
I wouldn't say that because I think I don't know much about medical school, but I'm thinking they probably hit on different things, but it's not a priority, if I may use that word. It's not like it's
Hmm.
cancer or tuberculosis or something like that. So I'm sure they discussed it, but I don't know about the emphasis.
Okay. Does anybody know, has doctors or researchers found out the cause of sickle cell yet?
I mean, it goes back to it being an inherited blood disorder. So again, it's a, kind of going back to our science classes in the sense that chromosomes are passed down, and so from your mother and your father, and so it's just a genetic disease.
So it's not an environmental thing. It's not something you get from food, where you live in your environment or anything. It's just a genetic of how the chromosomes and the cells connect within a person's body. Is that what you're saying?
Yes.
Okay, okay. So now, Miss Carter, you work for Red Cross, and Miss Mariah, no, Dr. Mitchell, you work for Tapestry. So let's get into how you all became part of this sickle cell organization to help people. Individually, start with you, Dr. Mitchell. How did you get interested in sickle cell and work with the Tapestry organization?
Well, long story short, both of my parents had sickle cell trait. There are 6 of us. 3 of us have sickle cell disease, and 3 of us have sickle cell trait. I have a baby brother. My baby brother passed in 2018 from sickle cell disease, sickle cell SS. I have a baby sister. She has sickle cell disease, sickle cell SS. I have sickle cell disease, sickle cell SS. Most people won't believe it because, like I said, it's such a tricky disease. Some people are sick all the time. I've been blessed. I haven't been sick like that. Pain crises, very, very few. But I got into it because of my youngest brother. Um, he battled all of his life. He was diagnosed at age 4 with sickle cell disease. And, my parents were there, very supportive. And my parents got married in the 40s. So there was no talk about sickle cell trait, sickle cell disease. So what happened? Both of them had the trait, so they had sickle cell. Uh, Children with sickle cell disease. And let me say this: even if you have 2 parents who have the trait, they may have a child who does not have sickle cell disease or not even have the trait. But in our case, there are 3 of us with trait, with sickle cell disease, 3 of us with trait. And that's how I got into it. I wanted to educate people because I can remember when my brother was diagnosed at age 4, I don't remember anyone testing the rest of the children in the family to see if we indeed had
Mm.
sickle cell disease and sickle cell trait. I discovered I had sickle cell when I was in my 50s. I was not having any pain crises. I was always anemic, but was never diagnosed until I was in my 50s with sickle cell. That's
Mm.
my story. And that's how
Beautiful story. And I
the
and I always
organization Tapestry Connections for Sickle Awareness and Support.
I always, when I ask people how they got into their career choice, I love to hear their story because it always has to do most of the time with something personal that affected them positively or negatively, in their childhood or as they were growing up into adults. So, you, Miss Carter, how did you get involved with sickle cell and Red Cross?
Right. So I've always worked for various nonprofits, and I've always worked in the medical field of some sort. And my focus has always been on educating our marginalized groups on just different things about the medical field, whether those were conditions or illnesses that they experience. And what attracted me to the American Red Cross was them really buying into trying to help marginalized groups. One of the things that I love about the American Red Cross is our mission. And a part of our mission statement is to alleviate human suffering. And I just think that that's so powerful. And so we
Yes.
know that there's different service areas that the American Red Cross has. Most people know us for our blood services, but we do all sorts of things as far as services to the armed forces when we have any sort of disaster or things of that nature. And so that again, I always talk about alleviating human suffering is so powerful to me. And I think sometimes in our society, we've become so desensitized to things that are happening around us. It's like someone is suffering and we just turn a blind eye because it's not directly impacting us. And so for me, I've never been that person. I've always have had, I'm very empathic. And so I've always had a concern for others, even if it didn't directly impact me. And so I just appreciate the opportunity to be able to talk to people and educate people about the value of donating blood, because a lot of times, particularly in our communities, it's not something that we think of. And so, yeah, that's how I got in this work.
Okay. Okay. So now that I know how you got into your individual careers, how did Tapestry and Red Cross fuse together and come together on this one um, prevention of human suffering?
Yeah. So, again, with the Red Cross, we're always looking for opportunities to partner with different people. Particularly, like I said, we started this initiative in the middle of the pandemic. It started in 2020, and so with that, we were looking for different organizations that would partner with us to be champions to push this initiative of sickle cell disease. And Tapestry and Dr. Mitchell has always been a intricate part of helping us to push the mission. And it's always great when you can connect with people that are like-minded and have the same goals in mind. And so again, it just made sense for us to partner together to educate people about the value and importance of supporting patients that are battling sickle cell disease.
And and because it's so prominent in the African American community, is the medication for it expensive? Is it affordable for those who need it?
Um, I think most of the people that I know who are taking some of the new medications, they haven't had any issues with that. But that's a good thing that you brought up, because sometimes they do introduce new medication, and because of the pricing, people can't afford it. So our organization, that's why we're doing awareness and also supporting them, and they're in other ways as well, maybe helping them with their medication expense if we have funds available. But yeah, sometimes that
So
is an issue.
I know recently, a couple of months back, President Biden signed a bill to lower the cost of insulin for diabetics. Um, is there anybody in the sickle cell organization that you do that is on Capitol Hill champion for the cause of cheaper prices for the treatment for people that can't afford the cost of it?
I'm having trouble hearing anyone.
Oh, okay. I said, oh, Miss Carter, can you answer that question?
I don't necessarily have the right answer for that. I mean, we're like I said, the consciousness again is has increased for a lot of people, and we have champions all over the world now for this disease. And so I'm not sure on the medication side of things and just the pricing of that, but I just know
Mhm.
that we have champions all across the world for this disease now. And so maybe Dr. Mitchell could answer that question a little bit better.
Okay. My question, Dr. Mitchell, was: is there anybody in the around the organization who is on Capitol Hill champion for the price uh, deduction of the medication for sickle cell for those who it's hard for it for to be afforded to them?
I'm not sure about that, but I know there are people who sickle cell is being discussed in Washington, D.C., as well as in the legislature here in Georgia. We always have our sickle cell day at the Capitol. And this past February, we had like 17 plus senators who came and spoke with us in support of sickle cell.
Hmm.
Um, on the Capitol Hill in DC, and an issue priority right now, but I established some federally cell centers because right now there are none. So I know that's worked as far as medication pricing.
Hmm. Okay, Miss Carter, you go to surrounding counties. How many surrounding counties do you service?
Honestly, I don't have a number for it. I cover 2/3 of the state of Georgia. So I cover your major cities like Savannah, Columbus, Albany, Valdosta, the Macon, Warner Robins, Fort Valley area. Um, I even cover a portion of Florida. So I basically cover the bottom half of Georgia, excluding the Atlanta market.
Okay, and can you explain what you do?
Yes, I'm getting a little lag, so that's what it's yeah, so what I do is I am so basically like I mentioned earlier, I go out and build partnerships with different organizations. So that could be churches, that could be businesses, that can be organizations, and so we educate them about sickle cell disease and just the need and I know we talk about that sickle cell disease does not, it impacts all types of ethnicities, but our focus at the Red Cross is really trying to engage our African American and Black communities. We try not to be exclusive, but we do want to get the messaging across of the need for people that are African American and Black to donate. And the reason being is because they have a unique ability to help patients battling sickle cell disease. Because those from other races and ethnicities, what happens is people that are receiving on the other end of it, receiving those transfusions, can have adverse reactions to those transfusions. And so we try to match it as closely as we can based off of race and ethnicity. And so what I do again is I just educate and I try to get those organizations, businesses, churches, fraternities, sororities to not just have a blood drive, but to create a blood program. And what that means is don't just have one blood drive and just be done with it, but consistently have a blood program where we're engaging their network of people on the value and importance. And hopefully we can continue to spread having champions in the various areas that I cover.
Okay, okay. Very good. You mentioned, Miss Carter, that your mother has lupus. Um,
Mhm.
you are you educated on lupus? Do you know anybody that can come back on the show and have that conversation also right now about lupus? Because I think it's interesting that I have this platform to educate the African American community and minorities on these different things.
Right. As far as like a medical professional, I don't, but my mother has suffered with it for the last 20 plus years. And so it to me it has a lot of similarities to sickle cell disease and just the way in which it, your body attacks itself. And so to really be honest with you, I didn't, my idea of donating blood shifted when I saw that my mother needed several blood transfusions before, and it was like, I think the concern is always, well, what if the blood isn't on the shelves? And so that's the
Right.
messaging that I try to push, especially with holidays. We celebrate these holidays and we have fun, but then a lot of times people don't think of donating blood. And so what happens is we run across shortages of blood and we don't have it on the shelves because the need for blood doesn't take a holiday. So in regards to lupus, I mean, it's such a, I mean, again, it impacts our African American and Black communities. So yeah.
Okay. Well, all right, ladies. Is it anything that you can share about sickle cell that I didn't ask about that you would like to tell the audience?
I didn't hear that entire question, but I would like to say in September is National Sickle Cell Awareness Month, and also Monday, which is Juneteenth, which is June 19th, it's World Sickle Cell Day. And
Hmm.
that's a worldwide emphasis or celebration for sickle cell disease. So
Hmm.
thank you for having me. I'm sorry I could not be at home in front of my laptop or desktop computer so I would have better reception. But I couldn't pass up the chance of all these people out here for this Juneteenth thing to
Yes,
pass out literature and talk about sickle cell disease. And then also, on Mariah's behalf, I am asking people to sign up to donate blood for our next blood drive, which is August 8th. So I do that as well when I said sickle cell. But I
I
appreciate you,
the
Miss Bailey.
well, the question I asked Mariah that you said you didn't hear was when Miss Carter said that her mother had lupus, and I asked her, did she know anybody that could come on the show and have that conversation um, to
Oh,
educate
okay.
this platform about that? Before you ladies leave, what advice individually, what advice or wisdom will you give someone that just found that was just diagnosed with sickle cell or is living with sickle cell? What kind of wisdom or advice individually can you give people?
Yeah, I would say to connect with with people that know about it, and who can provide that support. We talked about just some of the disparities that exist within healthcare, and a lot of times it can be so discouraging because you're trying to find help and maybe can't find help. So I would definitely suggest linking with organizations that are invested in this disease, like Tapestry with Dr. Mitchell or the Red Cross, that can really point you in the right directions to get the help that you need regarding this disease. And just really knowing that you have the support, you have people out here that are championing for this disease, I think it goes a long way. And I think it encourages and gives you that support that sometimes you need to make it to the next day.
Mm.
So that's what I would suggest, is trying to link with organizations that have the buy-in, because I know I experience it daily with my mother. regarding just the disparities in healthcare, and being tagged as drug seeking, and not having that support. So I would definitely say educate yourself as much as you possibly can, know your body, and be an advocate for yourself. I think that's so important.
Yes, yes. Very good. Dr. Mitchell, what's your advice or wisdom to people who just recently found out they were diagnosed with sickle cell or has been living with sickle cell?
Can you repeat that?
My question is, what advice or wisdom can you give to the community that's listening today, of how they can, what advice or wisdom can you give people who just was diagnosed with sickle cell or has been living with sickle cell?
Uh, I would say to them that they need to make sure that they hydrate, that they exercise, that they eat well, that they take care and have pain management, that they also have preventive care, get their vaccinations, health and dental checkups, make sure that they have a medical home that would include a primary care doctor, hematologist, dentist, and all of the others, because that's very, very important as well. And then I think most importantly is building a support system of friends and families,
Yes.
with their friends and their family. So they need to make, and then they can connect with community based organizations such as the nonprofit that I have, because we can connect them to resources. Plus, we have a community health worker that's sponsored by the Sickle Cell Foundation of Georgia, who will who's like a navigator who would make sure that they're getting all the services and resources to benefit them so that they can. And we always say this, that you can live well with sickle cell.
Thank you, ladies. That's good. So, if anytime you all come, find information that has updated the lifestyle or the living or the healthcare of sickle cell, you are always welcome back to share it with this community. And
Okay.
if you know of any other um, medical education that you can share with this community, you're welcome to get in touch with me and share it. And going to the event today, Dr. Mitchell, is the best way to reach out to people of giving out those cards, because everybody is out there being part of it and you never know who you're going to reach. They might not say they have it, they might not say they know anybody with it, but they'll take that card and I'm sure they will share it with somebody.
Thank you so much for having us on the show today.
You're welcome. It was a pleasure meeting both of y'all. Both of y'all. Yes, yes. I was out advocating my show when I met Dr. Mitchell. Yes. Well, y'all continue to have a blessed day and have a blessed Juneteenth celebration.
Thank you. You too.
Amen. Thank you.
You're
You as
welcome.
well. Bye bye.
Bye bye.